hopefully we can get started. My name is Noelle Pineda. I was class of 2010, Caillou co-chair. Oh goodness, that was 2007. And now I am at the medical school here, so I'm in my third out of 5 years. So I'll be moderating, and I'm hoping to make this as interactive as possible since it's such a nice, small, circular group now. So I'm hoping that each of our panelists, thank you again for coming, could maybe introduce themselves again, but with a little bit more focus on what you get to do in the health field. So whoever would like to start.
Me? All right. So hi, everybody. Donnovan Somera-Yisrael, class of '89, and I work at Vaden Health Center now, so if you're an undergraduate, I still work for you, and even if you're not, I still work for you too. So, so a lot of people don't know what I do because I'm not a therapist, I'm not a clinician. In other words, I'm not licensed to do anything, so I do everything. I'm a health educator, and so what we know about being healthy, whether it's physical health or emotional well-being, spiritual health, if you want to get into that, it's skill-based. And just like playing the piano or juggling, if you don't know how to do it, you have to learn how to do it. And that includes being happy. We have to find out what the skills are to be happy. And so I tell people what I do is I teach the skills of healing, because life hurts sometimes, health, and happiness. And what's really cool, we were just talking about this, that with the dawn of, when I studied psychology, it was mostly all the bad stuff, because that's how psychology's been for the past forever. And now we have what's called positive psychology. People are actually researching, there's actually like machines that pick up goosebumps to detect awe in people, and altruism and compassion and love. And they're actually researching all this now, right here on campus and other places. So it's an exciting time to be alive, because what we know, not just what it takes to be, to go from zero, to get to neutral. Like, who wants to wake up in the morning and go, wow, I feel extremely neutral today. But we know what it takes to not only be like neutral, healthy, but also get excited about life and to thrive. So I try to learn those things from books and TED Talks and go to conferences, and then I try to integrate them and relate them to people's lives and teach them. So.
Thank you.
All right, hi, I'm Sevilla. I'm class of 1991. After Stanford here, I moved all the way 30 miles up 101 to San Francisco, where I went to UCSF for medical school and then stayed there to complete 2 residencies in general psychiatry and child and adolescent psychiatry. After I finished that, I moved back down to Los Angeles, and currently I am both a practicing psychiatrist and the medical director for a nonprofit agency called Asian Pacific Counseling and Treatment Centers. We are a nonprofit mental health organization targeting the mental health needs of Asian immigrant and refugee communities in Los Angeles County. We operate 5 different clinics throughout Los Angeles County, from Van Nuys down to Cerritos. If you know the geography down there, it's a lot of driving on the freeways. But which is bad for your mental health. Yes. And your respiratory health, too. Yes. But I think it's a really exciting work, as we're kind of talking about life here at Stanford as an undergraduate in the SFA PUSO days, and kind of developing that sense of identity and community here. I was able to kind of carry that forth into the similar organization up at UCSF, now called PUSO, and got connected with other Filipinos who are medical students at other campuses throughout the state, and it just kind of led from one thing to another, where I just remained interested in issues of culture and health, found that psychiatry was a natural way to kind of address these issues, especially recognizing the stigma of mental health within our communities. And so, yeah, it's just been a really fortunate outcome for me, and a really good fit to be actually able to do this professionally. I mean, our main center is in historic Filipino town in LA, right near Silver Lake, if you guys know that area. So, I'm lucky.
Eangelica in 93. I urban studies.
You are Speaking of things bad for your health, being a pre-med at Stanford.
Actually, I have to tell you guys, I chose urban planning because it was October 17, 1989. I was reporting to 3 or 4 hours at the AQC, and all of a sudden, being a Californian, I just told everyone, duck and cover, and there was the earthquake. And so that's how I chose urban planning. I loved it. I think if I could do it all over again, I would still choose urban planning at Stanford. It's been a really good skill set.
Total tangent about the earthquake here. I was at East House at the time the big earthquake hit. And the funny thing is, I remember like all the people from the East Coast. They're like, "Oh, this is what an earthquake in California feels like! Wow!" And all of us who grew up in California, we were like, "Oh my God, we're gonna die!"
It's so funny, but it's these things from undergrad that really stick with you. So I think even early on, I definitely wanted to give back to my hometown of Santa Cruz, California, and that's been good. My parents were elderly, so it's always been interesting. I sort of fell into health services research because I love statistics. My mom had actually had both congestive heart failure, so her doctor, Dr. Vaden, was here, who ended up being my mentor. And so that was level 1 in Stanford cardiology. And then next level, actually the year after my mom passed away in 2003, I wanted to be closer to UCSF, but I still wasn't sure. I've always been an entrepreneur. I think Julius can give you all these stories. I was never 110% sure that I was just going to stop everything else that I wanted to do in the community, but I wanted to continue to sort of understand what was the technology. So then I enrolled into a traumatic brain injury registry. I was UCSF's San Francisco Department of Neurosurgery trauma registrar because I was bilingual in Spanish. And so we would get patients immediately after a loss of consciousness, they'd get rolled in. We would get a GCS score. We'd actually sort of really see if we could identify that they would be relevant for our study. And then we would do short-term and long-term functional MRIs. And it was really fascinating. I learned that I was a control, so there were a bunch of my brain scans floating all over Dr. Pratik Mukherjee's lab. But I learned really early on that, it's lifelong learning. I think that's one of the things that you should always accept about Stanford. Don't feel that because you didn't take all the OChem or whatever, that you shouldn't think about what medicine or health can be. And also, don't think that also maybe because you've already done the med tech route or maybe you're more in industry, that you can't still pause and think about going back to school. So I did. I moved to Italy, and very recently, I'm still in the throes of whether that program will actually be 100% California Medical Board certified. But before I moved to Italy, I did a summer at the United Nations, and that was really pivotal. If any of you are multilingual, don't ever lose your language skills. It comes back. I actually got that job because I speak Hungarian. Random, yeah? And it was through the International Disability Alliance. It was my first stay at the UN. And it was amazing to see Ban Ki-moon. I got to see Stevie Wonder. I got to see amazing people. But at the back of my head, I was like, did I get into my Italian program? And I chose Italy because of Doctors Without Borders. So as an American, we can't just go to Afghanistan. We can't just go to occupied territories. It's actually very dangerous for MSF to send Americans just anywhere. Interestingly enough, Italians are loved and accepted everywhere. So it's called Médecins Senza Frontiere, or Doctors Without Borders. So if you're affiliated with the Rome office, you could actually train with your mentors, and they can send you to all of these rather risky areas of the world. So, I've always been giving just of my own personal savings to MSF. It wasn't until I got in, I enrolled in Napoli, and I got to find amazing women in surgery who were incredible. I mean, she just came back. One of my mentors, general surgeon, Italian, did 6 months in Syria, and it was the same month that doctors were kidnapped in a related facility in Syria. So they pulled her out, and then she, being an amazing woman, went ahead to Kabul anyway. And so she's just, I think, wrapping up her last 6 months. So one thing I can say about having helped out on both with fundraising and also logistics, they will tell you that you have to have done 2 years of residency at least before they will take you as a clinician. And if you're doing trauma, you can only do usually 3 months at a time. But with like an urban planning degree or a project management degree, you can actually do logistics. So they take civil engineers, they take logisticians, they take grant writers. It's very diverse. But you could also think about which country you want to be affiliated with. And interestingly enough, because Italians are so charismatic, they were among the first of MSF to also be deployed in the Philippines during Hainan. So I think I always wanted to give back to the Italian group of MSF, and I guess that's sort of the one box of my resume that I'll address for today's panel.
Great. So obviously we have a great sort of spread. How I'm thinking we could run this is, rather than wait for the end at questions, I feel like we might traverse a lot of different topics, because we're talking both about Filipinos who work in healthcare as well as the state of health of Filipinos, both in the States and even abroad, because of the experience of our panelists. So if you have a question, just like raise your hand, and after some of the panelists answer the questions, I could go to the crowd, just to keep it, as opposed to going through so many different themes and then coming back to them at the end. So the first question that I had for everyone is if people could just share what originally inspired you to go and pursue a career that you did that was within health, and particularly if you remember any of your experiences here at Stanford that maybe played a role in that.
Mine definitely, I could say that, so I lived in Casa Zapata my freshman year, and if you've ever been in that lounge, before there were flat screens, they used to have the TVs were kind of behind like the cabinetry and whatever, the wood paneling there. I remember watching Gene Kilbourne videos, some of these critical thinking videos along the lines of, there's a new misrepresentation video that just came out on men that everybody should see. If you are a male or you know anybody who is a male, you should definitely see this video. But along that line of kind of critical thinking about culture, Gene Kilbourne talks a lot about, she started the movement around sort of violence against women, and then also media images of objectification and body image issues. And so that really got me excited. I became an RA thereafter, also in Zapata, but critical thinking became a very powerful, maybe that's why all teachers are teachers, right? To expand somebody's mind to where they see things in a different way. And particularly around health, I see health as an issue of oppression in a sense, right? When we don't have certain knowledge, let's say we're, eating non-nutritious foods because we're in the inner city and it's a food desert, or whatever. We think that in order to be accepted, we need to be skinny or have a six-pack or whatever body image issues there are, whatever it is. Drinking alcohol to be accepted. That there's a critical thinking and a cultural literacy piece there that I have to be able to look at any culture that I'm in, whether it's Toyon or whether it's a fraternity, and ask the question, what's healthy about this culture and what's not healthy? I think, and so that just really got me excited. And so I got a job in San Mateo County and then Santa Clara County doing HIV prevention in schools. So traveling around to schools just after HIV broke as a major pandemic, and teaching kids about safe sex, and then getting more into the psychology of it. A lot of my career has been around asking the question, why do people do risky things? Why do people take risks through their lives? Why do Stanford students not wear bicycle helmets to the level that they should? Although, by the way, it's like at 30% or something, like some ridiculously high number now of bicycle helmet wearing on campus. When I was here, it was like less than 1. Yeah. So it's actually pretty good now. But still, 30%, and medical school is probably doing the best, but still, they're only at 44%. So like at least half of Stanford students are not protecting this really important investment. Not only is this little computer the most advanced computer we know in the universe, and you own one, but then you've invested millions of dollars and time in putting information in it, and one hit to the ground at 5 miles an hour, and you could never come back. And you have more padding on your eye device than you have on your head. Does this strike you as odd? We should have a big cooler around our head when we walk outside based on that. Yes. Because we're old and we don't care if we look sexy anymore. But anyway, so this is the kind of critical thinking that turns me on. It's like if I can just open people's eyes to the ways in which we do damage to ourselves. There's a great Dove ad out there, if you haven't seen it, by the way, about having women in France talk to themselves the way that they talk to themselves around their bodies. It's just devastating to watch. So anyway, that's what gets me excited, is opening up people's minds to a different way of being that not only can keep them from doing damage, but actually can make them happier. We were just talking about self-compassion with medical students, and I'll just say this and stop, but we're incredibly harsh to ourselves. All of us are incredibly harsh to ourselves, incredibly mean to ourselves. If we ever spoke to another human being the way we speak to ourselves, we wouldn't have any friends. And this to me is the root of all evil, in a sense. and I'd love to hear you guys' perspective on this in terms of health, is shame. And shame manifests as self-deprecation and self-criticism constantly. And then we wonder why we have eating disorders and cutting and suicidality and all this stuff. I mean, if your whole life you're spent with a person who's really abusive to you, you might want to die too. So anyway, I'm really passionate about helping people to be kind to themselves and learn these skills.
As a side note, the helmet thing, it's because the first week of medical school, they brought in a doctor who had a really terrible bike accident. And he comes and speaks to you, and it's a really emotional session, and then they pass out helmets.
Yeah.
And he shows us the helmet he was wearing when he got into the accident. He got hit by a car on Palm Drive. He's like, if I was not wearing this, I would not be here today. And that all of us were just like, where's the helmet? Like, I will take it happily and wear it. So maybe if they do that in the undergrad level,
programs that get to the heart and then hand out helmets afterwards.
Yeah.
Stanford students started to do this too. There's an undergraduate RA who had a similar experience. She actually just woke up and was in the hospital because she has no idea how the accident happened.
So there are active ways to do some of these things. And
wear your helmets.
So much inspiration. Definitely my mother. I mean, I almost have to say I went into medicine because I was such a caregiver for such a long time. I have a lot of cousins in the Philippines who were raised to do nursing. I think a lot of our culture is very compassionate, very directed around immediate care. And I think it's a skill set we should never lose. Even now, I struggle with whether, do I want to work with my med tech startups? I'm sort of moonlighting. I'm doing one thing in Sausalito. So the startup the company I just joined recently is actually going through an acquisition. So I'm just counting the days, the epics of my adventures until I can really go back into the things I'm very passionate about. I think, when you see your mother and you see other relatives in the family really not really take care of themselves, it sort of sticks with you. So, if you know that there's a genetic tendency in your family for diabetes or cardiac events, she had both the heart failure, insulin, so she had the type 2 diabetes, as well as she had to go on renal failure, so she had hemodialysis 3 times a week. And it's very difficult seeing your loved one with these needles, and you don't do a lot for 2 to 3 hours at a time for 3 times a week. And within 36 hours, if the patient doesn't have the filtration, the dialysis, that's actually, my uncle went through the situation. So he chose between my mother and my uncle, I think those two instrumentally, and he was a doctor himself. That's always been sort of the back of my head, how does one choose to grow old? How does one choose, and there's a great phrase in Spanish called bienestar, well-being. You think a lot about this, right? And I think Stanford people are very privileged in that we have a good education. The food here is really good. It may be too good. You could eat a lot when you're an undergrad. You don't eat a lot when you're studying, I think. But I think it was the decision-making for me I spent so much of my time actually enrolling my mother in different clinical trials. We actually published a paper on patients around, it was amiodarone versus a defibrillator. Do you want to turn blue when you use this drug, but at least it helps you with your cardiac arrhythmia, or do you want to have a battery pack in your heart, So I think for 10 years I was always a caregiver, like more than really. And I've always sort of been very entrepreneurial, and I think I still am. But I think what Stanford really enabled me to think about is the decision-making at any point in your time isn't something that's dictated by just your degree or your degree choice, or even what you're publishing. At one point I thought I would have definitely done something much more in neurotrauma, just because that's where my mentors were, maybe something more related to diabetes. But I think this concept of being global and also being a global female is really empowering. So I think for all of us in this room, I think someone earlier in the panel talked about CC. I think our culture is we're very open, and people are not so conservative about reaching out to us, whether it's because we're female or maybe we're Filipino American, I don't know what it is. But I feel like every step of the way I've always had people give me their health conditions, ask me advice, even just because I'm their relative. And I think it was time to sort of give something back. My mother had also been a teacher in Samar and Leyte, so that got hit really badly during the storm. And my very good friends are actually Hazara. I don't know if you guys ever saw The Kite Runner. It's worth seeing. So there's there's a lot of difficulties right now in even keeping women clinicians through MSF in Kabul proper because of security. So MSF, Médecins, Frontières, they actually just recently decided to choose that only the outskirt hospitals would be getting other European and other foreign female care workers. You know, so these kind of things, you know, how do you want to give back to your relatives, maybe? That was really what carried it for me here.
Boy, I'm not sure I have such a coherent story. I mean, had things gone as planned, or as I had planned, I would actually be on the other panel discussion right now, the arts.
Take note, guys.
When I came to Stanford, I actually spent almost 2 years as a music major here. My career path was to write musicals. And so I was doing that for a while. I played in the pit orchestra for several Ram's Head musicals, countless dorm musicals. I was in the Stanford band. I also had our own band here, the Electric Monks. That's right. And, you know, occasionally you do like the jazz combo gigs for a little spending money. Anyway, I got to the point where I realized I probably didn't have enough talent to make a career out of it, and that's kind of a harsh realization. So I figured, okay, gotta switch gears here. At that point, I had taken 1.5 quarters of organic chemistry, and it was going okay. I said, okay, I'll be a chem major. So switched to chemistry, became a pre-med. As you can see, I really had this well thought out and planned out. But it, you know, academically kind of worked out okay. And then, as I was saying in the previous panel, I had the opportunity to be part of HAPA, a multiracial Asian students organization here that we founded. It was the same time that SFA/PASU was starting to come about as well. And I think that really kind of resonated with this sense of longing for community in me. And so part of the reason that I did choose UCSF for medical school was their dedication to outreach and servicing underserved communities within the Bay Area. I was the only Filipino American in my medical school class, so representation was an issue up there too, about 1 out of 150 per year. But there I had the chance to kind of recognize that there could be a connection here between that interest in community and culture and practice of healthcare. So I'm thinking, okay, I'm going to be a primary care physician, treat the whole patient, pay attention to psychosocial needs, get out there on the front lines. Then I go to Salinas to do my family practice rotation as a 4th-year med student. I'm seeing 6 patients an hour. Yes, that's 10 minutes per patient, including history, physical, running it by your attending, documenting, next please. 10 minutes is not enough time to get to know a whole person. And I started recognizing that actually psychiatry gave me much more of an opportunity to pay attention to these issues of culture and community and health behaviors. And I had a really good mentor up there, Francis Liu, who was one of the pioneers in Asian community cross-cultural psychiatry and getting into the issues of how do traditional cultural beliefs affect one's response to mental illness. What are the considerations that need to be taken care of when providing treatment in a culturally appropriate or culturally competent context, and even into looking at some of the issues of biological factors that affect one's response to medications and tolerability and so forth. And yeah, then I realized, well, I could actually make a career out of this. And so when I finished up my training, an opportunity with APCTC down in Los Angeles came up, and my wife told me we were moving to LA anyways. And so kind of got started there as a staff psychiatrist and got interested in the macro level stuff. How do you treat not just the patient in front of you, but an entire community? And that's where my interest in the administrative aspect came to. So right now I do about 25% of my time is administrative, 75% direct clinical services.
And in terms of representation at Stanford, in my entering class now, there are 2 Filipinos out of a class of about 90. So every year there's about 1 or 2 Filipinos in a class that's growing. So now there's a class of 100, and I think there's also 1 or 2 Filipinos in that class. So we haven't increased that much over the time either. Does anyone have any questions before I move on to my next question? Anything that came up? So the next question, it's gonna be a 2-parter, so you guys can chew on it a little bit. Is what do you personally think are the largest health challenges facing Filipino communities today? And what role, if any, does Filipino culture play in the health of Filipinos today?
Sounds like a natural one for you, Donnovan.
Me?
Yeah.
I thought it would be you. You're the one seeing it all. One word, lechon. No. I want to hear what you have to say, treating, the greater Los Angeles area. It's a little wider than what I'm about to say, but, I think, so a couple things. One is just in terms of seeing with my folks, I'm going to Sacramento to see my mom and dad in a little bit, and they're the healthiest in their cohorts. They have large families of siblings, most of who have moved to the United States from the Philippines, and they're some of the oldest, and they're the only ones not on any medication regarding diabetes meds and or heart meds or any of that stuff, which I'm pretty excited about. And they kind of took on the health movement. They've been eating salad since the 80s, and and exercising, and really kind of took that on, and vitamins, and going to Whole Foods or whatever, and the co-op, and getting different remedies. But I think culturally speaking, I think that making the transition from the Philippines to here, and I think this is true of a lot of people in the modern age, right? Is back in the day you had, the way my uncles eat, right? They had mostly rice on the plate, and then they had a little bit of fat and a little bit of meat and a little bit of vegetables and sauce, right? And it was like a mouthful of rice with a little bit of stuff. Now you have a mass amount of everything, and I think that we're seeing this in there's studies on Native Americans in America, the Pima and so forth, and I think it is challenging for all of us. I mean, we do have an abundance, but yet our reward systems in our brain haven't changed over thousands of years, and so when you're confronted with, I don't know, Cara's cupcakes or sprinkles, I mean, one of those would have been, that's enough nutrition and joy food for your whole village back in the day, and it cost as much as 5 chickens also. So to buy a cupcake, but so I think that is a challenge, sedentary lifestyle and some of these things. So that's, and I know that these folks can comment more about that. One thing I just want to throw out there also is I think that I think it's an exciting time. I think I grew up in the self-help movement days of the 80s and 90s, and now we have a lot of research that's either backing up or disproving a lot of self-help. So I think it's really exciting. And I think that what I want to bring to the Filipino community is along, and you can comment on this, a more sort of introspection and a thoughtfulness around their inner lives, emotionally and spiritually. I think I'll just tell you my biases. I'm Filipino, obviously, but I'm not Catholic anymore. I'm Jewish now, Reform, Progressive Jewish, and I think I just want to I'll just say it. I think that unfortunately, what I believe is that unfortunately, a lot of my spiritual and beliefs were set by Christianity and by the teachings of Jesus. But I think there's also a lot of shame that comes out of Catholicism around sexuality and around there isn't necessarily sort of and this is true of a lot of religions actually other than Buddhism. There isn't a lot of sort of teaching of psychology in those religions of how to actually, like you could say don't be angry, but how do you not be angry? Like it doesn't teach you how to, and I think Judaism doesn't do that either. Buddhism has a psychology built into it of how to calm your central nervous system through breath. So I just want to put that out there, that I think that what I would want to offer to Filipinos, and I guess maybe everybody, is teaching us how to manage this thing, this very complex spiritual, emotional, biological creature in daily life, traffic and stressors and aging parents and PhD programs and research papers and breakups, right? All of these stressors, how do we do that? And I think that there's a lot of different fields that comment on that. And I think, as I've said before, I think that shame is the root of all evil, unfortunately. It's not the devil to me, it's shame. It's that when we feel that there's some part of us that is bad and dirty and not worthy of love, I think that if you what I just said, I think is the root of all the problems that we see with college students, high school students, and everybody else, from eating disorders to why we don't wear helmets to cutting and body image issues, and alcohol abuse and abusing food and what have you. So I think that that's what I would want to put out there to really educate people about how to manage this in a way and to reduce shame and to increase health. But I don't know if I answered the question.
There's so much I don't know how many of you are taking statistics or epidemiology or public health, so definitely mirror a lot of what we heard from Donnovan, but also I think, at the end of the day, most of us have dual career parents, so our parents no longer make home-cooked meals. Often you're lucky to have the family sit down together, 4 or 5 meals of good food. And I can give you context because I just lived this past year, very fortunately, I'm not Italian, but I loved it. I lived in Napoli. And in Napoli, everything closes for 3 or 4 hours. No joke. Monday through Friday. God bless Italy.
In the middle of the day.
Huh?
In the middle of the day.
Absolutely. Yeah. Absolutely in the south. And in Campania, first of all, we have no genetically modified food. And I can actually even tell you that the pomodori, the tomatoes I buy here are not tomatoes. It's it's still green, and then they use ethylene gas to ripen the fruits and vegetables, right? So even if you purchase something that's organic, I have an idea that if it's in bulk consumption, it's probably been gassed or processed, even if it wasn't a GMO. So in Italy, everything's literally farm to table, and you buy everything every day. And you buy at the corner from the grandfather who's been sitting there doing that for 60 years. And that is the secret of being more fit. If you look at the Sophia Lorenz of the world, they don't go to the gym, they don't do crazy stuff the way we Americans do. They just eat good home-cooked food that's not genetically modified. And they take the 3 or 4 hours often to prepare it right. I think that's the real problem, and it's not just us as Filipinos. Our ancestors, right, they had the time, or at least they didn't have the flexibility to go to a Jollibee's or to a McDonald's, right, which is probably not what we should be doing. I just moved to Sausalito recently, and everybody there is so healthy. There is no McDonald's, even if I want one. I can't find it anywhere. It kills me. But, and I just look at the way people age in Marin County. They age very well. They do have the time they have the socioeconomic means to cook food at home and to spend the time sitting and enjoying a conversation and actually enjoying your quality of life every day. So if you have the flexibility as children of Filipino immigrants to take it back to what Lola and what our ancestors always did, it's probably one of the best ways to really avoid diabetes and obesity if you have the time.
So I guess I have a couple of thoughts with regard to that. One, just talking more briefly on general health. Your one word was lechon. I guess if I had to choose 2 words to talk about general health issues in the Filipino community, it'd actually be bahala. And that we have this kind of traditional belief of kind of fatalism, and it's already been decided, and so therefore there's not an impetus for me to change my own personal behaviors as far as my own health goes. And so why not have that extra serving of lechon or a little more chicharrones? And you look at our food. I love our food. It's so delicious, but it's all high fat, high sodium. It is not the most healthful diet, at least as it exists currently. And so it's not surprising that Filipinos compared to other Asian ethnic groups have much higher rates of diabetes and the other issues that Eangelica and Donnovan have both brought up as well. But as a psychiatrist, of course, my big interest is mental health issues, and there's, I think, some significant cultural factors at work there as well. Certainly, I mean, you bring up the issue of shame and how toxic that can be. There is plenty of shame around mental illnesses in our community. You don't talk about it. If you have a family member who is seriously mentally ill, you try to keep it within the family. You try not to let others know about it. Maybe you keep that person home all the time and isolated from the rest of the community, because it is a shame not just on that person but on the entire family. And so by the time somebody actually makes it to Western mental health care, usually they are much more chronic, much more severe, and the prognosis is usually much poorer. Add to that the fact that in the Philippines there is not widespread access to Western mental health services. I mean, there's the huge psychiatric hospital in Mandaluyong, and I think there is certainly a growing community of therapists and psychiatrists practicing at least in the major urban centers. So if you're in Makati or Cebu, you're probably in pretty good shape there. Anywhere else, you're not going to have access to that, even if you were to seek it out. And traditionally, we will seek out just about everything else first. First, look to family members for help, turn to clergy members, then maybe a primary care physician. But yeah, the crazy doctor like me, we are definitely the last resort, and not something you want, you want your neighbor to know about. Along with that, there's a lot of traditional beliefs about Western medication being too strong, being actually causing craziness, and so we run into significant problems of people stopping medications as soon as they get a little bit better, and then of course we see problems with relapse, with current hospitalizations, and so forth. And then there's also the more traditional beliefs about what causes mental illness. As a San Francisco trained physician, of course, I am aware of the biological aspects of mental illness and dysfunction at the receptor level or other factors there. But that's not how the people that I work necessarily see it. Coming from a predominantly Catholic culture, a lot of us see mental illness as the result of some sort of sin or the will of God, that it's a punishment for something that you did or something that perhaps maybe one of your family members has done. There's also a lot of kind of more naturalistic or animistic beliefs that nature or spirits within nature can cause mental illness. So, one woman that I was treating for postpartum depression, comes in with the extended family member, and grandma was saying it's because, she went outside and got exposed to the wind, and that's why she had this. So one of the challenges, I think, in providing culturally competent mental health care is being able to listen and understand and try to negotiate a common space of understanding. If you come at it with the attitude, no, that's silly, that's wrong, that's, that's not what really happens, you'll probably never see the person again. But if you start with the attitude, tell me what you think's going on. Well, let me listen to you first. Then we can at least begin to open up a dialogue where I can say, okay, and what would you traditionally do about this? And then I can share our perspective, what we know from research as far as the medical factors, and we can try to find a common ground as to how they can pursue their spiritual healing at the same time, I treat the diagnosis and the person in front of me. So that's kind of what I try to do.
Any follow-up questions from the rest of us?
Well, I have a question about failure. I'm not sure if it follows this part. Is it okay?
No.
So one of my favorite quotes, but I don't remember it exactly, is the NBA superstar Michael Jordan. I said, what makes you so successful? And he talked about the thousands of missed shots, or the final shot that they were relying on him to make. That's what makes him successful. Could you share with any of you one of those missed final shots this last year, maybe in your career, or just to give us a glimpse of what makes you successful?
I mean, for me, I could probably tell you individual stories about that, but I think I thank you for asking that, and I think that failure tolerance is something that we should be teaching as a resiliency skill. In fact, one of the mentors from the positive psychology world, Talbot Jahar, who taught happiness at Harvard, said, "Learn to fail, or you will fail to learn," which I think is a great quote. You can't really learn without failure. It's just not possible, and yet a lot of us are trying to avoid failure to look cool, whatever. I tell my kids, if you're not falling down, when I teach skating of all kinds, and if you're not falling down, you're not trying hard enough. You're just staying safe in your comfort zone. Those who are really going for it are going to fall a lot, and hopefully we're wearing a helmet. We're going to get there. So, but for me, it's a constant humbling, so I'm a presenter, I'm extroverted, I took improv, and so I just saw Dan Klein, by the way, if you go here, take Dan Klein's improv class. I just go off, and that's what I think makes me good at what I do. Having said that, I put my foot in my mouth quite a bit. And get humbled when somebody says, you offended me when you said that. Or the way that you said that was flip, and I remember I was doing a talk at a residence, and I used cutting as an example, but used it in a flip kind of way. And the person says, I don't think it's okay to joke about cutting, it's not funny. So I've been humbled a lot as a male, particularly in my privilege that I have, that males have, being told. When I worked at the YWCA, there was a women's group from Pally and Gun students, and my colleague Carolyn Laub, who started the Gay Straight Alliance Network in San Francisco, she said, you were standing up, you were talking loud, you're the only male in the room, and you're really old, you were 25 or something. And these are all 16-year-old. So I think for me, it's a constant assessment, and so let me be clear. It gets a little more nuanced. I also have a sensitive internal dialogue that tries not to get into my internal critic too much, because that's shame, like thinking I did a horrible job when I really did do a horrible job. So it's kind of understanding the ways in which I made a mistake and really accepting them at that level, but not overplaying it also and saying, wow, I'm a terrible presenter, or, does that make sense? So how do we honor the maybe 80% that was good, or 85%, and say, yeah, there was 15% that wasn't so good. I'm not going to beat myself up about that. I'm going to say, I want to be better at this. And so can I take that feedback into consideration to be a better person? But I think there's been a lot of situations that I could tell you, particularly around male privilege, where I've wielded that privilege unskillfully, and it's hurt people in certain ways, and I've had to hear that feedback, and it's been humbling, and to try not to go into shame, and I can expound on this if you want, but take it in as more as constructive criticism, and in some cases healthy guilt, but not shame. Healthy guilt being, I'm a good person who made a big mistake. Shame is, I'm a bad person. You see the difference? And so I think that that's a major shift in just the semantics of it can change your life, because if you can always hold true to that, you are born worthy of love and goodness, and even people who are on death row or who did something horrible, we could say that they have an essential humanness that should be honored, even if they've behaved terribly. Again, it gets tricky when you get into murder, so we don't have to go there. But that if we can always, no matter what the mistakes we make, and sometimes, by the way, our mistakes are not even really ethical violations, they're just embarrassments, like you did something really awkward at a party, and like that. How many people here like remember something they did that's really embarrassing, and it still haunts you today? Whenever you think about it, you're like, oh my God, I did this horrible thing. It's not even an ethical violation, it's like something really random that culturally is awkward. And so we as humans are very self-conscious, but I guess back to my point, I think we really need to, the way to be failure tolerant, I think, is to say, well, first of all, to take Dan Klein's Improv 103, Drama 103, because improvisation is all about the ability to make mistakes and be mediocre and celebrate that, and be hilarious. But we need to be able to say, you know what, if when I make a mistake, it's not a challenge to my humanity, right? Like if I wanted to teach you guys all juggling right now, we would really suck for a long time. We would drop a lot of balls for a very long time. That doesn't mean you're a bad person. It means you just are not very good at juggling for the next hour or 10 years. And yet what happens is when we conflate mistakes with I'm a bad person. And this is the big mistake of it all. No, you are if that were true, then we would take all the babies in the world and put them and get rid of them because they're terrible at everything. Walking, they just poop everywhere and they're not. And yet we don't look at a baby and say, wow, you're a really bad person. You're bad at math for now, but you are cute. And so we need to shift that. But yeah, I mean, I think if that's what you're asking, I think building up our failure tolerance and maybe even embracing failure. Wow. I mean, talk about not being able to succeed. I mean, you wouldn't even be able to avoid succeeding. If you could be a person who could walk towards failure, in other words, take appropriate risks to improve, and we're relentless with that. Just like inventing the light bulb apparently took thousands of iterations and what have you. There's no way you're going to stop. There's no way you're not going to be a success. It may look different than you think, but you're going to be a success because you're going to keep doing it. You're going to keep at it. You're going to be resilient. You're going to be tenacious, and there will be success at the end of that in some way. So.
I'm still trying to formulate.
There's just so many nuances, and it's such a great question. I think every day is a great opportunity to think about what could I have done better, how could I have communicated a little bit more effectively or a little bit more compassionately. There's where would I start from recently to many years back. I think my biggest problem is I really, really hate to say no. No to myself, no to other people. And I think since I came back to the United States, I've purposely not really told everybody that I'm actually here. Like I'll filter a lot of my time. Even just since I moved to Sausalito, again, I have everybody who's like, we should totally do this and this and this and this. And I think I've just been so stretched thin with all the international travel and just the past year. So I think a good guide for being in medicine or in healthcare or in research is always take care of yourself, because you won't be able to withstand those 80 hours a week in clinic or 60 hours a week cramming for USMLEs or whatever you need to get through if you don't take care of yourself. I mean, I think that's number one. I think if you can sort of manage to carve some quiet time, it could be running. I always get to see Brett's feeds of the next best run he's done, or whatever you love to do by yourself or with a group of friends that you sort of manage, that you have that sort of, we call it locus of control for. It's huge. Don't fail yourself and the time that you need to be healthy.
Yeah. By the way, because I'm a teacher, so everybody know the no sandwich? The no sandwich is you couch your no in 2 yeses. So you say, thank you so much for inviting me to your house to move your furniture. I'm glad that you thought of me. It must mean you have great regard for me. And sorry, I have something else I'm doing on Saturday. But the next time you want to move furniture, please feel free to call me. You know, so you have to. That's the no sandwich, and you have to be able to say no to other people because. And
is that what Rand said when you invited him?
Yeah.
Thank you for inviting me to
Rand,
Boston's 25th reunion. I'm sorry I have to go to New York. But I'll be there for 50.
Remember that when you say yes to other people, you might be saying no to yourself. And that we have to be able to say no to other people to say yes to ourselves. And it's hard because we do, a lot of it's, but we want to do stuff. It's not just that other people are asking us to do stuff we don't want to do, we want to do stuff. But the whole oxygen mask thing has been used ad nauseum, but you do need to live a sustainable life where you can, the one thing that technology has not given us, in fact it's made it worse, is given us more time in the day. So now we have all these things we can do to kill time with the video games and with Facebook and whatever. We do need to be able to say no to other people to allow ourselves to live. And one last thing, in positive psychology, you know, you can have a lot of money and you can have, but there's other kinds of affluence. The two kinds of affluences that we tell people about is time affluence. This is appropriate to the medical school and other things. You'll never be happy if you don't ever have enough time. You'll never be happy if you don't ever, if your life, you can have all these, you can have 5 Teslas in your 6-car garage and you can have a big house in Atherton. If you don't have time, you'll be impoverished. And then the other one is obviously social affluence, which also can eat up your time, right? The more Facebook friends you have, and the more Eangelica is very popular. You know, then you also have to say yes to your friends because when it feeds you, but you also have to say no to your friends. I love you, but I can't come to your event because I have family, right? Julius's main gig now is his family. So coffee with you, he may want to have coffee with you, but that little girl is more important to him, and that's okay, right? So anyway.
I'll just say a little bit, I guess. Obviously it has relevance to my line of work, but I mean, it also has personal relevance. I love what Donnovan is saying, and especially because I am so bad at practicing it, and really always have been. I think the other thing that drew me to psychiatry, in addition to the community aspects that I was talking about earlier, has been kind of looking back, kind of my own struggles with depression throughout my life. And I mean, I can really trace this back into childhood. I mean, as my wife and I were like looking through like my old kind of photo albums, we could not find a single picture of me smiling anywhere. And it would, it'd be like, 6th grade birthday party. Here I am sitting in front of the cake looking. It's interesting because my mom's a clinical social worker, and obviously she never picked up on it either. And I went to a public high school that was not particularly academically oriented or challenging, so I cruised through there with minimal effort, got my valedictorian and all that, and so came here, and it was just a massive shock. I did not have the study skills to succeed here. I was not used to being around so many incredibly smart and competent people, and so what's the conclusion that you draw from that? I am really stupid, and they made a big mistake. By letting me
I
in.
have that disease. Yeah.
And so I actually wound up looking into transferring my freshman year because I was so convinced that I was going to drown here, and that I would not be able to hack it. It kind of helped that I visited some friends who were going to another school that ironically was my first choice for undergrad, but I changed my mind at the last minute and came here. Serendipity is like the story of my life. I do not plan things out well. But kind of realizing that a lot of the same issues were there. It wasn't Stanford that was making me feel the way I was, that this was more internal. So back when it was still called Cowell, went there for the first time ever, talked to a therapist, and was told that my problem was, I want to be more Asian, and all the Asian kids are really smart, and they're doing really well in school, so that's my problem. I'm just conflicted about my identity. That wasn't too satisfying. So, yeah, kind of let it go. Continued to struggle through that, continued to struggle through med school. And, you know, it's interesting. I think maybe, there isn't one point I would say where things really turned around. It was this kind of gradual evolution. And I think starting to get a better sense of identity here was a big part of it. Doing my required psychotherapy during my psychiatric training, I think helped a lot. My wife has been incredibly helpful with it too. And I think I have a hard time saying positive things about myself even now, but I think the one thing I can say is that somehow I just managed to keep going. It's like, oh, you know, it's like, okay, I may be the stupidest person here, but they haven't kicked me out yet. So until they call me into that dean's office and say, Brett, we've got some bad news for you. Let's get as much as we can going here. So, you know, it's actually kind of funny then that, you know, about 10 years ago I started getting into running and ultimately wound up starting doing marathons. And it's the same kind of dynamic. It's this sort of masochistic experience. You're hurting by the end. You feel like, why did I do this? I don't belong here. Everybody else is so faster than me. But then you finish and it's like, okay, well, maybe we could do a little bit better next time. So 6 days from now, I'm actually flying to Boston and I'm running the Boston Marathon next week for the first time. So, yeah, I think in my case, I think the key to dealing with the failure has been just keep going, even when you think that you can't. Well, unless somebody's like yanking you out of class, well, just kind of keep, fake it till you make it. And, try to surround yourself with a few people that really get you and will stick with you even if you do fail.
Thank you all for sharing those things. So I love that the theme sort of that's brought together the different things we were trying to talk about is self-compassion and self-care, because I think it is both if you're going into the field of medicine or health in general, or just if you're concerned about the health of Filipinos, I think that's a really important and key tying theme. So sort of in that vein, if you guys could go back and give yourself advice to when you were undergrads here at Stanford, and also for the ones in the audience who are either considering a healthcare related field or things like that, what advice would you give yourself?
I think one thing I would say is that there are options besides med school. Yeah. It's probably funny that I'm the one saying that.
Thank you for saying that.
Yes.
But I think also being here at Stanford, I'm guessing it's probably like that now, if not worse, but here it's like if you wanted to go into a healthcare field, you were pre-med. End of discussion. Yeah. And there are a whole lot of other healthcare opportunities besides med school. Just at UCSF, you got a school of pharmacy, you've got a school of dentistry. Then there are all the non-MD requiring ways that you can make huge differences to people's well-being, or working in the community to improve, health-related behaviors, access to health care. One of the things I really like about doing the administrative work that I do now is that I feel like I can make a difference without necessarily having to get out my prescription pad and writing something. I would say know that there are other options besides pre-med. If it's health of your community that you're interested in, you have more choices than just med school.
I could go on forever about this, but as a culture, we don't really value prevention, unfortunately. As we speak, they're hiring more psychiatrists here at Stanford. They're hiring more at Pali High School, who just had a recent suicide. And to me, that's like, it's fine. You know, and by the way, let me just say, I've been in a lot of individual therapy for the last 15 years, couples therapy, grief therapy, all kinds of therapy, so I'm a big fan of therapy. And we need to be teaching these skills to people before they get to really bad places. We need to have regular teaching and coaching of young people. You can teach mindfulness to a 5-year-old. If with your daughter, you put a rock on her belly when she's lying down, or a stuffed animal, and you say, make the stuffed animal go up and down. You're teaching deep breathing that can help her to calm herself down when she's frustrated or angry. You know, they use snow globes. You know, look at the snow globe. This is what you feel like when you're stressed out and angry. And look what happens when you let it calm down. All the stuff goes to the bottom. We can teach this stuff, and we're just not doing it. There are some people teaching mindfulness in schools in Oakland and some other places, and there's a whole self-compassion movement. So be a teacher. I mean, because the reality is that there's a lot of research happening in the world, but it's not reaching the people. It's in the ivory tower, as Tal Ben-Shahar would say, but then what are the people on the street? Are they learning this stuff? You know, I guess if Brene Brown is on Oprah talking about shame, then maybe people are watching Oprah. But we need to be teaching this to the people, because psychiatry and psychology is really good, but honestly, these guys, they have 50 minutes with you. They don't have time to talk about all the things they need to talk to you about and teach you all the skills. So it'd be it'd be like if we didn't have teachers to teach tennis and math and the piano, and all we had were people who would help you to fix it once your math and piano and tennis was broken. Like, it doesn't make any sense. Like, you have to have teachers. And so, again, I don't have any credentials to do anything. I have a generic psychology degree. I have a generic sociology coterm, for which I neither took the GRE or wrote a thesis. My wife's like, they give you a degree? And yet, I teach skills. And we need to be teaching this to people. And when we don't teach those things, we wonder why our males are violent and our females are hurting themselves in these ways. It's because we're not teaching these things. So that would be my claim. And to you, future physicians, as you were saying, 6 patients an hour, you don't have a lot of time to teach. You don't have time to teach people anything, not even like, oh, here's how to read the side of a box to see how much salt is in your potato chips. Like, you don't have time to do that, much less anything. So I don't want to be totally anti-everything, but we have to teach, because otherwise we're just catching bodies that are flowing into the ER. And that is not sustainable. That is just not sustainable as a culture. And it doesn't lead to good outcomes either. It's much better to stop a forest fire than to stop a forest fire before it happens, than to try, you guys are from California, to try to stop a forest fire after it's been burning. I mean, and that's what I want you to think about in terms of all of these issues. We don't know why depression is completely there, but I do know that if we had a culture of people who were actually nice to themselves and talk to themselves like they talk to their puppy, darling, sweetheart, to their lover, we would see a different form of those things. We wouldn't see as much, I think.
I had the pleasure of attending the Stanford Women's Leadership Conference last weekend, and I'm a huge fan of our current Dean of Engineering, woman, 9th Dean, physicist, fabulous. Her insight was really powerful, which is, first of all, leadership comes in many forms. Don't be afraid to try it out. And I think if someone had sat down with me freshman year and said, it's absolutely okay to stand out, and actually being Asian American, Filipino American, there was an earlier question by Jamar about what's different being at Harvard versus here, right? I'll tell you what's different. You definitely stand out having a tan, for sure. Use that to your asset. I think if someone sat down with me and said, you will always stand out, don't worry about it, that's actually a form of leadership, because you're memorable. At a job interview, my name is always the first discussion. Is that a typo? There's usually a somewhat condescending white male on the other side of that conversation asking me, is that right? Yes, it's right. My mother wanted my name to stand out. And so I think, be in touch with yourself, be well educated with the statistics of who we are, what we do in undergraduate, sort of how we could improve on all of that in graduate level and in work. But I think at the end of the day, if someone sat down with me and said, you're always probably helped a lot of other decisions I made along the way.
So I want to thank our panelists. I think lunch is coming up right now, but if anyone has any burning questions, because we didn't have that much time to like open it up and hear from other people.
Guys, who's in healthcare here?
What fields are you guys in or going into?
I work for a nurses union, so I'm not the direct care provider, but we're working with nurses so that they can be empowered to make sure that patients get their care. And it's funny, I never saw myself working for a healthcare union, but there was a time, a long time ago, when I was here at Stanford, and me and several students got arrested at the Stanford Hospital in solidarity with healthcare workers here at this university. So at that point, I was like, oh, sure, why not? There's a lot of Filipinos in the hospital that would help be in solidarity, and here I am. So thank you guys for sharing all of your experiences.
I work in public health and community health. Our organization does a lot of health outreach, education, advocacy for Southeast Asians in Long Beach, Cambodians, and Laos. We do patient navigation, home visitation. So when you say about health education, totally get it. It doesn't take 10 minutes to change someone's behavior, right? That takes a lifetime. We're housed in a hospital.
Did you get a public health degree?
Yeah, so I got a master's in public health as well as a master's in Asian American Studies at UCLA.
Great.
Thanks to Dawn Mabalan when I took her class here. So I was really interested in that social justice lens, but from a public health perspective.
Social work and public health degrees are great degrees to get. Yeah.
How many of you are current undergrads?
I work for you, so don't hesitate to call on me.
Wear your helmets, guys.
Again, this might sound like funny advice coming from me, but my advice would be don't study too much.
I agree, as a med student too. Undergrad, you're going to relearn it all. They make you relearn everything, so have fun.
I think, the pressure from being a pre-med student, and as well as the other internal unhealthy pressure coming from myself, made me miss out on some opportunities here, and also limited my ability to enjoy those opportunities. Posse/SFA was great, but there's always that voice in the back of your mind. You should be in green right now. You should be studying. You've got 2 midterms next week. What are you doing here dancing Take It Clean? I'm sure that's a conversation lots of people have had in their heads.
Yes.
But I'd say, give yourself permission to have those experiences, because it's hard to have those later on, but there's always time to study more down the road. Give yourself a break.
Thank you again to our
Thank